Now I'm going to do the first splint with using a different material, which is an ortho glass. This is what I'm going to use. It's the same way that I use in the hand. And back again, you have this already pre-cut. So you have to get this little clip off. And you're going to get, remember you push it up. So the last person who used it, it pushed this in to prevent to get, to get dry. What you do is you have to make a, if you can make it like this. And again, you have that already set up and ready to cut. Again, you can use a Weber, you can use a test measure, you can use anything to measure the foot. Again, I like to give it like a 2 inches down of the knee. I got my measure already here that I need. Now I'm going here in the splint. I have the end in here. I know it's there. What I do is I go here and I put up what I need. Is this. I measure it. I usually want to cut it like a 1 centimeter or 2, maybe more, because again, I like to cut it backward. Okay, now I cut this up. I want to prevent this to get dry because other people need to use it. Now I got to fold it back the best I can. Again, I got to fold this back, and I got to put this clip to clip it up to prevent to dry it off. Oh, it is on. Now you already measured the splint. You're going to get it out of the packet. This splint already comes with, you can see both sides have padding already. Again, I like to peel my padding back because I don't like this little hairs or fiberglass in here. A real danger. It can get real hard. It can cut the skin of the patient. I'm going to cut it back. Make it nice and nice. I'm going to bring it back, and I'm actually going to stretch this the best I can to make it more. And I'm going to do the same thing back in here. You can see this hair. I don't like that. Peel it back, and I'm going to cut it to make it nice and neat. Fold it again and pull it both ends. Again, in this one, I always like to make an extra 2 or 3 layers of padding. More, this one is the foot. The reason is because patients put pressures on the foot. Usually the patient put the ankle or the heel and the top of the tables, and this is when the patients get a lot of sores. I have 3 in here layer, which is okay. 3 in here and 2 for the padding. It is good enough. I'm going to put my gloves on because I got to use water. Again, you use the bottle, a bottle like this, and what you got to do is just sprinkle the water in the zigzag. You get it back again, and you do the same this side. Again, you get your towel, put it in the towel. What you got to do is you're going to roll it in the towel to get all this extra waters out. Roll everything out to get. You can squeeze it to get the water go through all the fiberglass. So you get all this done, you can get it up. Now you got it nice and wet. You get your extra padding. Again, I always like to give it some space in the top when you fold it down. Now you're ready to start. You make sure you get all your stuff. I need 2 of the band. Go down. Again, I don't care if it goes down. The main thing of this is concentrating the foot. Ask the patient to put the foot at 90. Let it go down when I'm getting ready. I start it back again. And the foot. I'm going to go up. I'm putting this up. This one I want to make sure that it's okay, nice, it's nothing. Put it inside. I can pinch a little bit back this way. That way the edges is not going inside, and do the same thing in both sizes. Go up, and I go with my elastic band this back again. Rolling, trying to get again 1.5. When you roll it, I never stretch this up. I still get my webber, my splint, everything together to make sure that it's not, I don't leave nothing behind. Again, I never stretch this up. This is one. I actually keep the foot in neutral or 90. Again, I'm in the back of the knee with 2 fingers out, which is great. I got my second roll, and I started from the knee below. Back again, do not stress this up. Please do not stress this elastic bandage. You can make it real tight. It could be normal, 1.5, kind of quick, because you want only to cover up. Try not to have any wrinkles. The best you can. And that's what you do is you molder. Like again, make sure it is not finger. I'm molding this with my palm of my hand. You can actually do this, or you can do this up. I still not using my fingers. Give it time for the splinter. This is fiberglass, which is going to dry it up more quick than the plaster. Plaster take a little bit more time. This one is, and you make sure that your foot, if it's a 90, this is 90. Make sure it's right there. Looks okay. And this is what I call a shoulder splinting with using the fiberglass already pre-made. Like again, you make sure you want to molder the ankle, and you want to molder the calcaneus or Achilles tendon a little bit. Again, using your palm of the grip and your palmar. And this is the splint. Short splint using the already pre-made fiberglass.